Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, September 10th, 2021, and this is our COVID briefing. So today in Missoula County, we're reporting 114 new cases of COVID-19. The last time that we saw more than 100 cases in a day was at the very beginning of December last year. In fact, so far in this pandemic, we've only had 3 days where we've seen more new cases than what we're reporting today. We continue to see the hospitalizations increase, and we now have 28 Missoula County residents and 12 out-of-county residents hospitalized in our hospitals here in Missoula County, and we've now had 112 deaths due to COVID-19. Our 7-day average daily new cases per 100,000 people is now at 57. So today I'm going to talk about masks, cases of COVID-19 in children, cases at the University of Montana, long COVID, hospitalizations, the new Mu variant, and breakthrough cases. So we have a lot to cover today. So let's start off with masks. Community Medical Center, Providence St. Patrick Hospital, and the Montana Nurses Association are all urging the public to wear masks. Community Medical Center and Providence St. Patrick Hospital say that wearing masks is critical right now. They say that the patients that they're seeing are much sicker than in previous surges, and the patients are requiring much more staff and supplies because of it. The Montana Nurses Association announced that they have serious concerns with the scientific inaccuracy and legality of a rule recently put out by the governor's office and DPHHS. That rule stated that the science on masks is inconclusive and parents should be given an option to have their kids not wear masks in schools. The health department, the Missoula City County Health Department, agrees with M&A's assessment. The evidence is overwhelming. Masks do help slow the spread of COVID-19. In fact, this week the CDC came out with yet another new study that shows that masks work. The study conducted at St. Louis University found the widespread use of masks and less contact or time spent close to persons with COVID-19 can limit the spread of the virus in university settings. Everyone in areas of high transmission, which we are in a county that is considered high transmission right now, should wear a mask when in close contact with others in public indoor spaces, regardless of vaccination status. So next, let's talk about what we're seeing with COVID cases in kids. Data from a new CDC report shows that the hospitalization rate among unvaccinated adolescents, so those that are aged 12 to 17 years old, was 10 times higher than among fully vaccinated adolescents. The report also found that hospitalization rates among children ages 0 to 4 showed a 10 times increase from late June to mid-August. The CDC recommends that adolescents get vaccinated as soon as they can, and that everyone aged 2 and older wear a mask in public indoor spaces in areas of substantial or high transmission, and in schools and in child care centers. Nationwide, children are now representing 26.8% of the weekly COVID-19 cases, according to new data that's been released from the American Academy of Pediatrics. Over 2 weeks, from August 19th to September 2nd, there was a 10% increase in the cumulative number of COVID-19 cases in children since the beginning of the pandemic. Local data this week shows that cases in 0 to 9-year-olds are the highest that they've been since the pandemic started. There are currently 47 cases in that age group as of September 9th, and cases are also higher in 10 to 19-year-olds. So I know that this is different than what we were seeing last year. The Delta variant is definitely starting to affect more children than what we saw with the original strain. So looking at a little bit older age group, as of September 9th, there are 19 active cases that are associated with the University of Montana. Throughout the pandemic, 20 to 29-year-olds have had the most cases, and that group continues to have one of the lowest vaccination rates. So university-age folks can really help us out to slow the spread of COVID-19 in Missoula County by getting vaccinated, wearing masks, and keeping social circles small. So I know it's been a long time since we talked about long COVID, so I have a long COVID update. A new CDC report released this week shows that many adults who tested positive for COVID-19 had long-term symptoms such as fatigue or tiredness, changes in smell or taste, and shortness of breath. The CDC is calling long COVID an emerging public health concern that's really not very well understood. Getting vaccinated could help prevent someone from getting COVID-19 and ending up with long COVID. About 28.7% of the participants with long COVID in the CDC study said that getting vaccinated actually helped to alleviate some of their long COVID symptoms. Next, I want to talk about the situation that we're in as far as hospital resources. Hospitalizations in Missoula are very close to nearing the highest COVID-19 peak that we've had during the pandemic, which occurred last November. Both Providence St. Patrick Hospital and community medical centers say that resources and staffing are making this surge incredibly difficult to deal with. In northern Idaho, hospitals are activating what is called crisis standards of care for healthcare entities, which means that they're having to triage their patients to determine who's going to receive care. This applies not just to COVID patients, but actually all patients coming into the hospital. This is due to many factors, mainly the overflow of COVID cases and the lack of staffing. When used in healthcare, the term triage refers to a method of determining priority for who gets care first. Triage is used when medical care system is overloaded, meaning that there are more people who need care than there are available resources. Triage can be thought of as a form of rationing, and it can be short-term, such as a mass casualty incidents in a war zone, or long-term, such as what we're dealing with in this pandemic. Triage has no set standard. It can really vary across organizations. Idaho has a larger population, so their total vaccinated rate is slightly lower than ours, but their total number of people vaccinated is about the same as here in Montana. Our hospitals are currently facing many of the same stressors as they are in northern Idaho, so this is why it's critical that we all wear our masks, keep our social circles small, sanitize and wash your hands frequently, and please get vaccinated as soon as possible to help prevent us from having to get to the point where our patients are having to get triaged. I know that we've started seeing some news coverage discussing the Mu variant, so here's what we know so far. The Mu variant has been detected in California, but not in Montana yet. US health officials are keeping an eye on it, but it's not considered a threat currently. It has been predominantly seen in South Africa, or South America, I'm sorry, where it's becoming the dominant strain according to the World Health Organization. There are ongoing studies to determine its properties, including how transmissible it is, if it's resistant to vaccine antibodies or not. These studies are ongoing, and there's currently no real data on this yet, but vaccine producers are confident that their products will continue to be effective against this new strain of coronavirus or COVID-19. Okay, so we've gotten a lot of questions about breakthrough infections. As of August 30th, the CDC has received reports of 12,908 severe breakthrough cases of COVID-19 among fully vaccinated people that resulted in hospitalization or death. For more than 173 million people who are fully vaccinated by that date, that represents less than a 1 in 13,000 chance of experiencing a severe breakthrough case of COVID-19. In those rare cases when a fully vaccinated person gets infected, the data suggests that it's usually older adults and those with multiple underlying medical conditions that are at most risk of serious illness. This is really in line with what we've seen here in Missoula County. At this point in time, only 1.18% of all vaccinated residents have experienced a breakthrough case. Okay, so that was a lot of information for today. If you would like to take a look at the data and the trends in Missoula County, please go to missoulainfo.com. You can click that little data tab at the top. If you have questions about COVID or you'd like to schedule a COVID test, please call us at 258-INFO and we can help you out there. Check out our Facebook page under the Missoula City County Health Department. We're always posting updates there. And as always, you can subscribe to us on YouTube under my name, Cindy Farr, that's CINDYFARR, and click that notification bell so you get notified when additional videos are uploaded. So until next week, everybody, stay healthy.